Hello everyone. Now I am going to discuss the topic food drug interaction, very essential topic for the subject hospital and clinical pharmacy for diploma in pharmacy first year students. This is the introduction part, that is the effect of drug on a person may be different than expected because that the drug interacts with other drug the person is taking. That is drug interaction, food, beverages, dietary supplements the person is consuming, or another diseases that person has, that is drug disease interaction. A drug interaction is a situation in which a substance affects the activity of a drug, that is the effects are increased or decreased, or they produce a new effect that neither produce on its own. These interactions may occur out of accidental misuse or due to lack of knowledge about the active ingredients involved in the relevant substances. Regarding food drug interactions, physicians and pharmacists recognize that some foods and drugs, when taken simultaneously, they can alter the body's ability. Simultaneously they may alter the body's ability to utilize a particular food or drug, or causes serious side effects. Clinically significant drug interaction, which pose potential harm to the patient, may result from changes in pharmaceutical, pharmacokinetic or pharmacodynamic properties. There are some risk factors of this food drug interaction or drug food interaction, that is some special diets, then nutritional supplements, tube feeding, herbal or phytonutrient products, alcohol intake, polypharmacy, drugs of abuse, non-nutrients in foods, and excipients in drugs or food. These are the some risk factors which causes drug food interaction. Now, food nutrients effects on drug action. We may say alcohol. So alcohol in combination with some drugs will produce additive toxicity. First one. Second one, with CNS suppression drugs may produce incoordination. And it acts as a gastric irritant, such as NSAIDs may increase chance of gastrointestinal bleeding. Now, this alcohol, it should not be combined with other hepatotoxic drugs such as acetoaminophene, amiodarone, methotrexate. We have to remember this point, that is alcohol should not be combined with other hepatotoxic drugs such as acetoaminophene, amiodarone and methotrexate. And this can inhibit gluconeogenesis when consumed in a fasting state, and it prolong hypoglycemic episode caused by insulin. There are some drugs effects on nutrients. For example, anti-tuberculosis drug isoniazid blocks conversion of pyridoxine to active form. And patient with low intake at higher risk may cause deficiency and peripheral neuropathy. Peripheral neuropathy. Avoiding food drug interaction. For example, the workup reveal no apparent medical reason for the impaired bowel function. After reviewing the PTS medications, the dietitian suggests that the patient given in liquid elixir forms containing sugar, alcohol might be causing the diarrhea. So there are some examples. So basically, a drug food interaction occurs when the food and the medicine interfere with one another. Interaction can happen with your both prescription and the over-the-counter medicine, that is OTC medicines. These include antacids, vitamins and iron pills. Not all medicines are affected by the food. Some though are affected by what the people eat or when it is eat. Taking a medicine at the same time can cause the body not to absorb the medicine. Certain foods may delay or decrease the absorption of the drug. It is very important point. For example, dietary products and antibiotics. Okay, one should not take the dietary product with the antibiotics. This is why some medicines should be taken on an empty stomach, that is 1 hour before eating or 2 hours after eating. Okay. On the other hand, what happens, some medicines are easier to handle when taken with food. Okay. If don't take them with food, you may feel nauseous or dizzy. This is often the case with some antibiotic. Okay. So regarding to avoid this food drug interaction, we have to always talk with the doctor or the pharmacist before taking a new medicine. Okay. So some tips are there, some steps are there, that is before taking the medicine what we have to do, that is read the prescription label on the container. Okay, you all of you should read the prescription label which is labeled on the container. Okay, read all directions, warnings and interaction and precautions. Okay, take all medicines with a glass of water. Okay, do not stir medicine in the food or take capsules apart unless the doctor tells you. Okay, do not mix medicine into hot drinks. Okay, do not take vitamins at the same time you take other medicine. Vitamins and minerals can cause problems if taken with some drugs. Never take medicine with alcohol. Okay. So this is the overview of this video, this topic, that is food drug interaction. Okay. So before going to conclude this video, I want to discuss some point, that is some medication which we have taken, we cannot be taken with certain types of food. The food can cause a reaction that changes the effect of the medicine. It also can create or heighten side effect. It may increase the side effect or adverse drug reaction. An example of this is having grapefruit or grapefruit juice with cholesterol drugs. Okay, if you take an ACE inhibitor, enzyme converting enzyme inhibitor, you should avoid foods high in potassium such as bananas. Okay. Then a change in a drug's effect on the body when the drug is taken together with certain foods or beverages. Not all drugs are affected by food, and some drugs are affected by only certain foods. Okay, a drug-food interaction can delay, decrease or enhance absorption of drugs. Okay. So some most dangerous food drug interaction, that is calcium rich foods with antibiotics, then pickled curd, okay, with your mouse inhibitors. Okay, vitamin K rich food plus warfarin, alcohol plus prescription stimulants, grapefruit, as I have already told that grapefruit and grapefruit juice with the statins. Okay, so these are some example of your drug food interaction. Thank you for watching this video.